Ever been told that you need a pelvic ultrasound or maybe you need a biopsy of your uterus? It's really common that this happens, particularly in our 40s and 50s. And a lot of times the culprit is this little thing called postmenopausal bleeding. Now, in this video, I'm going to talk about the three main reasons, and actually not even main, but the three reasons why we do proceed with ultrasounds and biopsies if you're having postmenopausal bleeding, and even if you're having perimenopausal bleeding that's abnormal, that can all kind of roll into this, and why that's really important for your health. So if you're interested in learning more about that, stick around. For those of you who are new here, I'm Dr. Heather Hirsch. I'm the clinical program director of the Menopause and Midlife Clinic at the Brigham and Women's Hospital and faculty at Harvard Medical School. And I love making these videos here for YouTube. This community has really grown, and it's telling YouTube that this is the premier place to get information on all things evidence-based surrounding perimenopause and menopause. If you don't already follow me over on Instagram, you definitely should. I really let you guys weigh in on a lot of the topics that you want to learn about here on YouTube. So definitely go check that out. I don't always respond to every single message because I'm getting more and more, but I read each and every one of them, and they're so amazingly helpful in me guiding this kind of content to give you guys exactly what you're looking for. I also host my very own podcast, Women's Health by Heather Hirsch. It's all about midlife women's healthcare. It's exclusively on iTunes. I'll drop the link in the description bar below. So what is postmenopausal bleeding? Well, by definition, i.e. going by the textbook, postmenopausal bleeding is any type of bleeding when it has been 12 months of you not having any bleeding or a period. So after you've had your final menstrual period, which is retrospective diagnosis, meaning you look backwards and you say, that was the last one, any type of bleeding after you've gone 12 months with no bleeding is considered postmenopausal bleeding. Now, it could be a period, it could be spotting, or even sometimes bleeding with wiping, especially if it's happening multiple times. Those are all considered postmenopausal bleeding. This video, I'm going to go over three reasons that could be causing that postmenopausal bleeding, so you can kind of file those away in your mind if you've been told that you are having postmenopausal bleeding and you need the following tests. The first thing your doctor is probably going to recommend is an ultrasound. Now, the reason we want to do an ultrasound is it can be a clue as to what is the cause or the culprit or the reason for your bleeding. Now, when they're doing an ultrasound, we're basically looking for two main things. One, we want to look at how thick or thin your uterine lining is. And that can certainly give us a clue, as doctors, we're little detectives about your health. That lining can give us a clue as to if this is benign or worrisome. Benign really is a term for fairly normal within what could be abnormal. And worrisome could be anything on the spectrum. It could be something minor, it could be something all the way up to something precancerous or cancerous. So we want to make sure we know as many clues as we can. Now, a sign that perhaps the bleeding was transient or benign would be if the lining is really thin, under 4 or 5 millimeters. If your doctor tells you your lining was thick or fluffy, that's another word that sometimes you might hear, it means that the lining was greater than 5 millimeters. Does that automatically mean something's wrong? Nope, it is just a clue. Then the next thing your doctor might recommend is an endometrial biopsy. The endometrial biopsy is when you go in for a procedure. It feels like a really uncomfortable pap test because what your clinician is doing is taking this little tiny pipette and trying to get out some of that uterine lining. We want to get that tissue and send it to the pathologist who's going to look at it under the microscope to help us better define what the tissue actually looks like. And then when we're worrying or thinking about your health, we can better place it on the benign or on the potentially worrisome scale. So if you do have postmenopausal bleeding, again, any type of bleeding after 12 months, you should tell your doctor. And your doctor may go on to recommend the ultrasound and then possibly the endometrial biopsy. All right, let's get now into the three big things that this could be. Now, It's absolutely true that there are many other things than just 3, but for the sake of keeping these videos down to 10 minutes and for the sake of YouTube, I'm going to go over the 3 ones that you really need to know about and that are typically the most commonly seen. The first reason that you could have postmenopausal bleeding is simply atrophy. Atrophy really means that the tissue is really retiring and it's just sloughing off. And that's what happens postmenopausally. After menopause, we don't make any estrogen anymore. Our ovaries, which are responsible for making estrogen, pretty much retire and go to sleep. And so a lot of the organs in the pelvis that respond to hormones, i.e., your uterus, and etc., they also kind of get the message that there's not much left to do. Doesn't mean it's good or bad, but sometimes what goes up must come down, and it doesn't mean there's anything wrong. Simply just gravity and the effects of atrophy over time. If there's any sort of debris or anything in the uterine lining that's just kind of built up over time, what goes up must come down. And atrophy is the main reason you can have bleeding. Now, you could also have bleeding that's coming from even your cervix or your vagina post-intercourse. And you are going to see that either on the toilet paper or the tissue or a pad as blood. But that's why we do the ultrasound. And oftentimes your doctor is going to also do an internal exam to see, could it just be atrophy from, the vagina or other tissues that are in the pelvis? Maybe the cervix, if that has a polyp that could bleed, or, other rare conditions like the labia, although you might know that that's what's bleeding. So the number one reason for anyone to have bleeding postmenopausally is benign, and it's simply atrophy. The second is hormonal. So I see this a lot when I am prescribing hormone therapy. Now, when I'm prescribing hormone therapy to someone who is postmenopausal and I'm using estrogen, sometimes that estrogen makes your ovaries who've retired kind of say, maybe we should come out of retirement. It seems like a good environment out there. Maybe we should give it one more hurrah and ovulate. And sometimes you ovulate. A clue that maybe you ovulated is you will come to me or your doctor and say, it felt like I had a regular period, just like I used to. I had breast tenderness and then a little bit of cramping, and then I had, 4 or 5 days of bleeding very similar to a period. That clinical history is really helpful because it may be that you just ovulated again, and that's from the hormones. Sometimes, again, even if you're postmenopausal, I know women don't follow the textbook, so could you randomly also ovulate? Yeah, you could. I have absolutely seen it, and that falls into the totally benign category. Another hormonal reason you could be bleeding is if I'm giving you estrogen, it's just a little bit more estrogen than your body needs. Your uterus is trying to be a good student and it's building up the lining and it's shedding. And I know that it's hormonal because if I'm doing that biopsy, that pathologist is going to say this looks like hormonally mediated tissue. And I'm going to know it's just from the hormones, and I'm going to lower your dose. Now, the last one is a big one, and it's uterine precancer or cancer. And that's the whole reason we want to make sure when you are having postmenopausal bleeding that we don't just say it's probably atrophy or it's probably hormonal. Now, sometimes it's really obvious. And sometimes when we do the ultrasound, there's really no clear concern. But if we are just not sure why, and most of us want to sleep at night knowing that we're not doing any harm to our patients, and if you are on hormone therapy, we want to make sure that it's not being masked by saying, oh, it could just be the hormone dose. We want to make sure you're not having any kind of precancer or cancer of the uterus. So that's the reason why we're going to get an ultrasound and do the biopsy. Now, the biopsy results are going to be the most important in differentiating if there's any type of pathology, i.e. something that we'd want to work up. That's going to be the most helpful to determine if that is what's happening. So number 3 is uterine cancer and precancers. If your doctor is concerned that after the biopsy, the tissue does look precancerous or cancerous, next thing that's going to happen is you're probably going to go for something called a DNC, where they're going to take a much better look while you are asleep with a camera than doing it blindly, which is what we do when we're doing an endometrial biopsy in the office. Then you're going to go on to have some other explanations to make sure you're really clear on your uterine health. Okay guys, I hope you guys found that video really, really helpful. If you want to take a deeper dive on all things menopause, I do have an incredible course called The Complete Guide to Menopause, everything you ever wanted to know your doctor never told you. It's super comprehensive. It's going to walk you through all the different stages from perimenopause to postmenopause, and definitely talk about the symptoms that you guys tell me you care about the most: weight, hair, memory, mood, as well as all the common things like sexual health, vaginal health, and hot flashes. So definitely check it out in the link below. The first lesson is free. I really, really hope you guys subscribe to the channel. I really appreciate your support. I'm so busy, but you subscribing to the channel and commenting below lets me know you guys want more content like this. So thank you guys so much, and I will see you guys next Monday for a brand new video. Bye everyone.